There's a very common topic that apparently a lot of people know about, but us medical doctors never got to learn in medical school. This is something that's called gases. A lot of people come to the hospital saying that they have gases. Now, I don't know what they mean when they say gases, but many of them are convinced that they have the nitrogen and oxygen inside them. So let's just get to understand what really gases are, because these people come to the hospital with a specific set of symptoms, which is very characteristic of something that we've learned in medical school. Many patients will come with pain in the epigastric region. Now, let's look at this photo. The epigastric region is this little circle right here. In this same area, some people will complain of a burning sensation, others will complain of a very sharp pain, and others will complain of pain as if they are very, very hungry. And this can come with nausea, it can come with vomiting, and the vomitus itself can be containing black spots, which is just blood that has been digested. When we refer these symptoms to topics that we've actually learned in the medical field, it usually brings us down to three things: gastritis, peptic ulcers, and gastroesophageal reflux disease. Now, these three are very similar in a lot of ways, but for the purpose of this video, we're just going to merely introduce them. In the subsequent videos, we'll look at each one of them in very good detail. For us to get a full understanding of these three topics, we need to understand some basic principles. Number one, we need to understand the anatomy of your esophagus and your stomach. So simply, this is a diagram showing this long tube, which is the esophagus, and this is a tube that when you take food in your mouth is a channel that takes all that food into the stomach. Now, between the stomach and the esophagus, there is usually a sphincter. Think of it like a door. It only allows food moving from the esophagus into the stomach. At no point should some of the food in the stomach move upwards towards the esophagus. This starts to create problems. Which brings me to the second point. Your stomach is full of acid. This acid has a job, and its job is to digest every food that comes in your stomach. However, this acid is very dangerous, and it's as dangerous as the battery acid that you have in your cars. So if this acid is this dangerous, why then doesn't it chew up the stomach because it claims to be so dangerous? Well, the body has mechanisms in which it protects itself. One of them is that the inner lining of the stomach is made in such a way that it has a protective barrier. Think of these protective barriers as 𝐸𝐶1 and 𝐸𝐸2. Don't ask me what they mean, but just think of them as a protective barrier. The last principle is that of inflammation. Think of inflammation as the body's response to injury. Injury can come from different things. It can come from being punched in the face. Another form of injury can be infections. Now, every time that you have injury, your body produces certain things, and these certain things produce certain responses. Let's say, for instance, I was to punch you on the face. You will notice that a certain part of your face which has been injured the most is going to start turning red. This just shows that there's a lot of blood going there, a lot of cells are going there, a natural response that the body has, and that whole process there is a process of inflammation. So far we know that the stomach protects itself, and nothing can go wrong as long as everything is functioning properly. But what happens when certain things go wrong? Let's say, for instance, your lining of your stomach gets messed up, or there's too much acid being produced that the lining cannot stand. And this brings us to our first topic, gastritis. So this simply means that the inner lining of your stomach, that inner part, the one that usually protects you, is failing to do its job because of different things. The most common thing that leads to this failure of protection is infections. And the most common infection is H. pylori infection, very much common. The second thing is using drugs like NSAIDs. NSAIDs are drugs like aspirin, diclofenac, ibuprofen, and these interfere with that inner lining, making it weaker, so that when the acid is produced, instead of being protected, it starts chewing into the stomach. Another thing that causes this, which you might not agree with, is excessive alcohol intake. This worsens gastritis and actually causes it. And lastly, stress. Patients who are clinically ill in the hospitals for a very long time, within 72 hours, these people need to be put on certain drugs, otherwise they develop these ulcers. So gastritis affects the innermost layer of the stomach. You don't expect to see a lot of complications. But what happens if that layer is breached and then it starts going deeper? This is where it forms a wound. And these wounds are called ulcers, which brings us to peptic ulcers. And sometimes they're also found in a part that's after the stomach called the duodenum. So there can be duodenal ulcers as well. These are the ones that cause a lot of problems. These are patients who will give you a symptom of pain as if they are very, very hungry. And this can even wake you up in the night because of this much extreme pain, and it happens randomly. These are people who, under an empty stomach, they'll experience so much pain. Ulcers come with a lot of complications because remember, they are digging deeper into your stomach, and the deeper they go, they're going to find blood vessels. So these are people who you find actually vomit out blood, and a lot of blood for that matter, to a point that you can lose so much and you lose consciousness. So you can see how gastritis and ulcers are usually related, and mainly their causes are about the same thing. And lastly, gastroesophageal reflux disease. This sounds very fancy, but we can break down each and every word there. Gastro just simply means relating to the stomach. Esophageal is obviously the esophagus. Reflux is when the food goes back. Remember what we talked about. It shouldn't move from the stomach to the esophagus. So in this condition, it's actually moving back. And then disease obviously means disease. So basically, this condition involves food moving from the stomach to the esophagus. Now remember, the stomach has acid, and then the esophagus doesn't know how to protect itself as much as the stomach. So when food goes back up there, this is where you get to feel things like that burning sensation, that one that you feel right here. You can then have nausea and vomiting, and this is very much irritating. The key symptom about this condition is where a patient will have a very good meal and sometimes a heavy meal, and then they go and lie down. Then you start feeling that at about 30 minutes or so. What this simply means is that you being in that laying down position, the contents of your stomach are moving back into your esophagus, because that sphincter that we talked about has either become weak and then food is going back, or you just took too much and then you went to bed early. Now the contents of your stomach are moving backwards. And this condition is also seen in pregnant women. This is mainly because pregnancy comes with hormonal changes, and one key hormone, progesterone, weakens that door that we talked about. So food will keep going backwards to the esophagus. And remember, a pregnant woman is carrying something as well. So it's pushing the contents upward, which just worsens everything. So if there's one thing that's common amongst these three conditions, is that there's certain foods that you shouldn't be eating, which just make them worse. And I'm going to list them down here. In conclusion, when a person says they have gases, it's either they have peptic ulcers, gastritis, or gastroesophageal reflux disease. In the next videos, as I'll be covering them one by one, I hope you pick out the condition that you may have. Cheers.